Welcome to this explainer on managing tacrolimus. Today, we're going to break down exactly how to handle this incredibly powerful life-saving medication safely and effectively. Whether you're a recent transplant recipient just figuring things out, or you're planning for your future family, mastering this drug is absolutely the ultimate key to your long-term health. So, your doctor just handed you a prescription for the gold standard of transplant meds. Now what, right? It's an understandably daunting question. Honestly, it can kind of feel like you've just been handed the controls to a really complex, high-stakes machine. But don't worry, we are going to navigate exactly what this new reality means for your daily life, your routine, and yes, even your future family planning. Here's our quick roadmap for today. We'll cover the gold standard drug itself, the narrow therapeutic window, your daily adherence guide, the strict grapefruit rule, motherhood and breastfeeding, and finally, some very reassuring safety data. All right, let's jump into Section 1, the gold standard drug. So, get this. Back in 1984, this medication was actually discovered in a simple Japanese soil bacterium near Mount Tsukuba. Crazy, right? Tacrolimus, which you might also see labeled as FK506 on your prescription bottles, completely revolutionized transplant medicine. It's a type of drug called a calcineurin inhibitor. Essentially, it blocks a specific signaling molecule that tells your white blood cells to attack a newly transplanted organ. And it does this exceptionally well. It's literally about 100 times more potent than older drugs like cyclosporin, which is exactly why it's the undisputed champion of preventing acute organ rejection today. Moving right along to Section 2, the narrow therapeutic window. Now, all that incredible power comes with a catch. Taking this drug is kind of like walking a biochemical tightrope. Your doctors want to maintain what's called a trough level. That's the concentration of the drug in your blood right before your next dose. They want that sitting at roughly 5 to 15 nanograms per milliliter, depending on your specific transplant. That sweet spot keeps your organ safe. But if that level ticks just a little too high, you cross right into the toxic range. The margin of error here is incredibly small. Too much of this drug restricts blood vessels in your kidneys, causing direct damage. It can spike your blood pressure, and it can even cause severe neurotoxicity, leading to tremors, insomnia, and really bad headaches. Which brings us to Section 3, your daily adherence guide. Because that margin of safety is razor thin, your daily habits are absolutely crucial. Let's look at 3 non-negotiable steps to keep your blood levels perfectly steady. Step 1, timing is everything. You've got to take your dose at the exact same time every single day. Set an alarm, seriously. Step 2, food consistency. High-fat meals can actually change how much of the drug your body absorbs. So you need to decide with your doctor right now, are you taking it with food or on an empty stomach? Once you decide, you must stick to that choice every day. No switching back and forth. And step 3, you have to show up for your routine blood work. And speaking of those lab tests, they aren't just checking your tacrolimus levels, they are actively monitoring your creatinine to make sure your kidneys are functioning perfectly. They're checking your electrolytes, like potassium and magnesium, because this drug can cause high potassium levels. And they're monitoring your blood glucose too, since tacrolimus can sometimes interfere with insulin and even cause new onset diabetes. Staying on top of these labs is exactly how you stay ahead of any potential side effects. Now for Section 4, the strict grapefruit rule. You really got to listen to this one. You must entirely eliminate grapefruit, grapefruit juice, and Seville oranges from your diet. Period. Zero exceptions. With a lot of other medications, a food warning might just mean you'll get a mild stomachache. Not here. With tacrolimus, eating a grapefruit is a severe medical hazard. Let's walk through exactly why this happens hour by hour, because it's actually fascinating. At hour 0, let's say a patient eats a grapefruit. By hour 1, compounds in that fruit have completely blocked an enzyme in your gut and liver called CYP3A4. Now, this is the exact enzyme responsible for breaking down tacrolimus. So by hour 4, with that enzyme blocked, the breakdown of the drug in your body just halts entirely. It's a total roadblock. By hour 12, the drug has artificially accumulated in your bloodstream, pushing your levels straight out of that safe therapeutic window and directly into the toxic danger zone. It's a really interesting biological interaction, but one you absolutely must avoid to prevent severe kidney and nerve damage. Okay, let's shift gears to Section 5, motherhood and breastfeeding. This is a question doctors hear all the time from young female patients. If a drug requires such exact precision, strict food rules, and routine labs just to keep a fully grown adult safe, is it even physically possible to safely nurse a newborn infant while taking it? Will the medication pass through the breast milk and harm the baby's developing immune system? Let's answer that in Section 6, the reassuring safety data. Well, the data is actually deeply reassuring. According to the LACMED database, which is the definitive government resource for drugs and lactation, an exclusively breastfed infant receives at an absolute maximum roughly 0.5% of the mother's weight-adjusted dosage through her breast milk. Think about that. That is a microscopic fraction of the medication. And practically speaking, what does that tiny percentage mean? While a low amount of the drug does transfer to maternal milk, averaging about 0.8 to 1.8 micrograms per liter, the blood levels actually measured in the nursing infants themselves are effectively undetectable. Their little bodies are simply not absorbing systemic, harmful levels of the drug. Furthermore, we aren't just relying on a few short-term blood tests here. Long-term international registries have tracked over 500 transplant mothers over a 25-year period. And the clinical outcomes? They are incredible. These breastfed infants hit their normal developmental milestones. They demonstrate normal physical growth. There are no clear patterns of unusual infections and zero serious adverse effects attributed to the medication in the breast milk. Because this data is just so incredibly strong and consistent over decades of observation, official U.S. and European expert guidelines definitively confirm it. Nursing mothers can safely provide for their babies while continuing this life-saving therapy. The medical community fully supports you in both protecting your transplanted organ and nurturing your child. So what's the big takeaway from this explainer? Yes, you absolutely must handle tacrolimus with immense respect and precision. You gotta set those alarms, skip the grapefruits, and stay on top of your labs. But if you do that, you are fully empowered to live a complete, thriving life, even safely raising a family. The science proves it's entirely possible. So knowing how much control you truly have over your health, what step are you going to take today to master your routine?